Hello, my name is Dr. Robert Wong from Stanford University School of Medicine, and today I wanted to chat with you all about patient-centric care approaches in chronic hepatitis B management. As you know, with the comprehensive management of patients with chronic hepatitis B, there are a lot of different aspects that we need to take into consideration in terms of disease monitoring, assessment for treatment response. One important thing to incorporate into your practice is identifying and implementing ways to incorporate patient-reported outcomes in treatment decision-making. What are patient-reported outcomes and why are they important in chronic hepatitis B? Patient-reported outcomes, or PROs, as I will refer to them, are ways to focus on how patients perceive and experience their health, which encompasses both physical, mental, and social well-being. And these are important because they're often underappreciated and underrecognized aspects of care that are critically important to the patient-centered experience. What are ways we can assess PROs in our day-to-day practice? There are a lot of different ways to think about and assess PROs. There's also a lot of different tools that are available. I will highlight a few of the tools that I think are most relevant and I like to use in my practice. The three that I would highlight, one, are the short form 36, SF36. The second is the Chronic Liver Disease Health-Related Quality of Life Questionnaire. And then the third one is something that may be a little bit less familiar to some of you, but also is relevant in really trying to get a holistic, comprehensive assessment of PROs in your chronic hepatitis B patients. And this is called the Work Productivity and Activity Impairment Instruments. Of course, there are a lot of other tools available, but these are the three tools that I like to use. They're simple, straightforward, validated, and especially the Chronic Liver Disease Questionnaire PRO instrument is designed specifically to assess PROs in patients with liver disease. The short form 36 also assesses different aspects of healthcare related quality of life. It's not unique to liver disease, but it's a very commonly used and well-validated tool, and it can be easily incorporated into practice. Now, it may be difficult to incorporate all of these into routine practice. One way to try and implement some of these is to develop questionnaires or surveys as part of the pre-visit checklist that you can provide to patients either prior to their visit or in the waiting room while they're waiting to be roomed. And that way it could be a very easy and efficient way to kind of get a broad sense of what aspects of PROs are affected. And then also it helps identify what aspects of PROs are important to the patient that you're going to see, because this can vary depending on patients as well as their perception of their health and social well-being. I think this is critically important in management of chronic hepatitis B because it helps fine-tune and narrow your discussion. It also helps identify avenues where we can better deliver patient-centered care. For example, patients that may be hesitant to receive antiviral therapy, sometimes focusing on patient-reported outcomes can identify what are the gaps, what are the specific barriers, and what are the specific concerns that we can try to address and educate patients on the importance of implementing antiviral therapy. Another way PROs are important, whether or not they're on therapy, is really assessing their understanding of hepatitis B and helping patients understand, one, the current impact chronic hepatitis B may having on their day-to-day life, their physical, mental, social well-being, and also use that as a springboard to educate and advise patients about the importance of continued monitoring and long-term follow-up. Another reason patient-reported outcome assessment is important is that it really brings in the concept of interdisciplinary care or multidisciplinary care, because by focusing and identifying on these specific aspects, it may help us identify other multidisciplinary team members that may also be able to help in the comprehensive management of this patient. And this would include colleagues such as those in psychiatry or psychology, if there are aspects of mental health and social well-being that could be better addressed, nutrition, physical therapy. All of these multidisciplinary team members can be implemented and incorporate it into the comprehensive care of our chronic hepatitis B patients. While we focus a lot just on the liver disease aspect of it, the PROs remind us that a comprehensive approach and really identifying what is important and what matters most for patients is key in trying to deliver high-quality, patient-centered care in chronic hepatitis B. Hopefully, this was a nice summary about the importance of reviewing, identifying, and implementing PROs in your day-to-day practice in managing chronic hepatitis B patients. If you'd like to learn more about PROs and chronic hepatitis B, please visit the Chronic Liver Disease Foundation website for more details and resources. Thank you.